Well, after the bin Laden bomb, here's something that could give the president some lumps. Healthcare costs now expected to jump by more than 8% next year, just around the time of the election. My next guest saw all of this coming, says that the White House's healthcare law will only make things worse. Betsy McCaughey, of course, the former New York lieutenant governor, and she joins me now. Betsy knows this healthcare law inside and out. I mean, it's like scary. But you know, you and I were chatting during the break, Betsy, we're all obsessing over this granny ad and whether Medicare is going to, with the changes Paul Ryan envisions, kick granny off a cliff. But you're saying we've got far more potent issues to work.
Well,
Explain.
Let's put this in perspective. The reports that are out today suggest that healthcare spending will increase 8.5% next year. I know that the administration has been harping for a couple of years on skyrocketing healthcare costs, but in fact, healthcare spending increased 10.5% in 1970, 13% in 1980. So for the last decade, it's been increasing far more slowly than in previous decades.
Is it slowing down?
It is slowing down.
Well, the president can say that it's doing that because of my arrival.
No, 8.5% is a little bit higher than the 6.5%, 7% we've seen over the last few years. What drives healthcare spending increases? Technology. Technology, new innovations. Walk into an electronics store and you will see things that weren't for sale 5 years ago. Walk into a hospital and you'll see the same thing, new kinds of medical equipment to save lives. So, for example, treating a heart attack costs about 3 times as much as it did in 1980, but you have a far better chance of survival. Nobody wants 1980s medicine at 1980s
Well,
prices.
is that at risk here with the law?
Well,
in other words, will these innovations go, whether they cost more or not?
Yes. The administration has said that in order to save public programs, they want to slow the overall increase in healthcare spending. That's like saying you want to save food stamps by putting everyone in America on a diet, or you want to make vehicles for the post office more affordable by controlling what kind of car everybody in America drives. The way to save Medicare is not by putting the entire nation on a healthcare diet and rigorously controlling, denying choices, rationing care. The way to save Medicare is to slowly inch up the eligibility age, slowly enough that people who are already nearing retirement aren't affected. Also provide competing private plans because competition in the private sector helps to control
Which is kind of the Paul Ryan approach.
Right? And then,
but he's getting crucified.
He is getting crucified because there have been so many falsehoods out there about throwing granny off the cliff. In fact,
I guess it really depends whether you like granny or not.
I'm a granny, so I
really?
really like grannies. I have a beautiful granddaughter. But here's the issue. Medicare, as we've known it, is gone. It's gone already. It was eviscerated by the Obama health law.
The idea with $500 billion lost out of Medicare the next decade is it goes to this.
No, they took $575 billion out of Medicare this decade.
All right, I said,
and
I said $500 billion.
They robbed grandma, and they used it to expand Medicaid, another public program.
You really know your facts, don't you?
The Ryan plan also reduces Medicare spending in this decade, but saves it, stops the rating, and provides that money will be used to pay for plans.
Bottom line, Betsy, isn't it? I always tell people, and it's an ugly truth. As time goes on, you're going to have to pay more.
You're going to have to pay more, but by the way, you get more. No one wants that black and white TV from 1980, and nobody wants that treatment for heart attacks that allowed you to die in 1980. Now you recover from a heart attack and resume your old lifestyle.
Yeah, nothing wrong with black and white TV, by the way. You look thinner. I do anyway. Thank you, Betsy McCaughey. Very good having you.